I rise to make two brief statements in relation to the two ministries with which I have responsibility for. Firstly, wearing my cap as the Minister with responsibility for Youth, Sport and Culture. Mr. Speaker, I wish to give a brief report on the recently concluded CPL Games, which would have been hosted in its entirety here in St. Kitts and ended on the 15th of September. Mr. Speaker, within the first 2 weeks of hosting of that cohort, in excess of 500 locals would have directly been employed and been remunerated in excess of $2 million EC dollars, well surpassing the investment made by this government. Mr. Speaker, the CPL Games were viewed by over 500 million viewers across the globe. That in itself is of tremendous value to St. Kitts and Nevis, showcasing not just us as a sporting destination, but us as a major tourism destination. Mr. Speaker, needless to say that those games brought tremendous financial and other benefits to the people of this country at a very difficult time as we battle this pandemic. An official audit is being done of the games, and a more detailed report will be brought, and I will report on the tremendous benefits that our people would have gained at a later date when that report is made available. I think it is important to also note, Mr. Speaker, that just this week, the Medical Chief of Staff of the JNF Hospital, Dr. Cameron Wilkinson, would have indicated that there is no link between the hosting of CPL and the current COVID-19 cases here in St. Kitts and Nevis. I think this is an important fact, and it shows that St. Kitts and Nevis is able to host major events and large gatherings in a safe way, as we did with CPL, allowing only vaccinated persons, patrons and workers to attend. This is testament of this government's ability to forge forward in the face of a global pandemic to the benefit of our people. As I end, I must indicate that our very own St. Kitts Nevis Patriots would have been successful, and I believe that success, particularly during the week of National Heroes Day and Independence, certainly brought about a certain renewed sense of patriotism and would have brought a bit of joy to our people suffering from COVID fatigue at a difficult time. And so I officially use this platform to give commendations to the local organizing committee, groundsmen, all persons who had any part to play in the successful hosting of those games. Mr. Speaker, I now switch my cap to that of the Minister of Education, and I provide an update on the status of our education sector here in St. Kitts and Nevis at this point. The education system in the Federation continues to function in the midst of the COVID-19 pandemic. It is obvious that as a result of the constraints brought on by the COVID-19, that our system cannot operate at optimum capacity. Our main thrust is to keep our schools open for the delivery of face-to-face instruction in a safe environment. To ensure that this happens, the Ministry of Education has prepared a set of guidelines for the opening and functioning of early childhood centers, primary and secondary schools, AVEC, and the NSTP. This document, to which I refer, is available to the public on the Ministry of Education's website, education.edu.kn. And Mr. Speaker, I must indicate that this is not the first time that we have done this. This is a document which would originally have been prepared in preparation for the last academic year, 2020 to 2021, and would have been made public would have been updated and made public prior to the start of this academic year, 2021-2022, to all stakeholders, parents, teachers, the general public. Situation report for early childhood development centers. The early childhood development centers have not been spared the fury of the COVID-19 pandemic. With a spike in COVID-19 cases across the Federation of St. Kitts and Nevis, the early childhood sector continues to experience a number of challenges, which appear to be slowly and steadily reducing. Beginning in late August, a number of staff members and children tested positive for the novel coronavirus. This led to the closure of a number of early childhood centers. However, with a number of recoveries of COVID-positive cases and full sanitization of affected facilities, centers have reopened to offer their services. Currently, all centers are in operation, although some sections or classes are affected by partial closure because of a positive COVID test for a staff member or child. In every center, there is the challenging issue of a reduced workforce to meet the daily tasks. A concerning number of early childhood employees are at home for an unanticipated long period of time. As they await results of their COVID-19 tests or that of their children, this problem has a ripple effect of overburdening and overwhelming those who are available to work, as the age and developmental stage of the children demand constant attention and supervision by the reduced staff. For a number of these employees, the present environment is filled with an abnormally high amount of work. In addressing the issue of significant numbers of staff members on leave, there appears to be some confusion related to the contact tracing protocol. Clarity and guidance have been required to outline clearly who qualifies to remain at home whenever a worker comes in contact with positive COVID-19 cases or contacts of such a case. That, as you'd have heard from my colleague, Minister of Health just now, has been resolved. It must be noted that the pandemic not only affects centers, but it also resulted in a period of closure for the Office of the Early Childhood Development Unit. However, the ECDU's staff continue to function remotely as they fulfill their role in the administration of the sector. The Office of the ECDU will be reopened shortly. Overall, the early childhood sector continues to function in the face of the COVID-19 pandemic. Commendations are in order for all the workers at any level in the sector who go above and beyond their call of duty in taking up the slack for those who are on leave. Situation report for primary and secondary schools. Mr. Speaker, 9 of our primary and 6 secondary schools, private and public, have been severely impacted by positive cases of the COVID-19. To date, among the student population, we've had 34 positive cases of COVID-19 in schools. There were 18 at the primary level and 16 at the secondary level. These cases have had the ripple effect of several classes being disrupted and a number of students and teachers having to be tested. The results of some of these tests are still pending. Other students are scheduled to be tested tomorrow, October 1st, and Saturday, October 2nd. This information is very well documented and monitored by the Office of the Chief Education Officer. Positive cases of COVID in our schools will not lead to closure of schools at this time, however. Instead, schools will implement one of 4 emergency level operations. For example, level 0, where school is open for face-to-face instruction and all students can attend school. Level 1, school is open but on a shift system where students attend school at designated times. Level 1 comes about as a result of loss of learning spaces due to acts of nature or construction, or to accommodate for physical distancing due to increased school population. Level 2, where school is open but testing and contact tracing is ordered by the Ministry of Health. Level 2 comes about where a student or staff member has flu-like symptoms or has been exposed to a positive COVID-19 case, where a student or staff member whose immediate family or a relative who have had significant close contact is in quarantine, and where a student or staff member who has tested positive for COVID-19. Level 3, where school is closed by the Ministry of Education. Level 3 comes about through a serious health issue, for example, mold or COVID-19. Where serious physical plant issues exist, for example, loss of electricity, flood, fire due to fire, or water, no water. And where the Federation is on a total lockdown, or schools are affected due to curfew. Mr. Speaker, in an attempt to make this information more readily available, the Ministry of Education is undertaking to publish a number of simplified flyers and publications to keep the general public up to date. The main goal of the Ministry of Education at this time is to reduce the amount of learning loss amongst our students. 4 schools are opening on a shift system: the Cotton Thomas Comprehensive, the Bastia High School, and the Washington Archibald High School. The Charles E. Mills Secondary School is also operating an alternative shift system. In terms of secondary schools, whatever the arrangement, plans are in place for fifth formers to be in school every day, all day. My ministry is advocating for 100% inoculation amongst high school in order to keep our school community safe. The Pfizer-BioNTech COVID-19 vaccine appointments and PTA meetings. The Ministry of Education, in response to the request from the Ministry of Health, outlined and implemented a plan to facilitate the sensitization of parents and ease with which appointments were made. 1, principals were asked to share the following information with parents of children who are 12 years and older. A, the school's appointment day and date. B, vaccinations will be administered from 1 p.m. at the assigned health center. They will be done in batches of 5 so as to limit wastage. C, appointments for students must be scheduled using the issued form of the school, can create, so that school can create an e-form which captures the given information. D, all forms must be submitted 3 days prior to the appointment date. And E, parents and guardians must be present with their child or ward at the time of the appointment and have the child's clinic card. As you'd have heard from the Minister of Health recently, the need for appointments is no longer required, and we will work along with parents, however, to schedule the presentation of the students at the various health centers so that we can capture the necessary information. Secondly, a form was created to capture the students' information and issued to schools for dissemination to parents. 3, an appointment schedule was created and each school was assigned an appointment day and date. The following medical facilities were identified: the Bastia Health Center, the Newtown Health Center, the Keon Health Center, Sadler's Health Center, Pogson Medical Facility, and Old Road Health Center. Only one primary public school has identified one 12-year-old, as most students will turn 12 years old in the next calendar year. Only Washington Archibald High School has inputted students into the Google Sheet, but principals were reminded. Since the appointment dates have passed, new dates will be identified and the school will be reissued the updated schedule. Principals were asked to identify PTA dates and enter the information on a Google Sheet. The Google Sheet also included the principal's contact information. To date, 6 of our 17 public primary schools and 3 of our 6 public high schools and 1 of our 6 private schools have set dates. The Google Sheets containing the students' appointment dates and schools' PTA dates were shared with Dr. Marissa Carty at the Ministry of Health to ensure that the information is readily available. Situation report for school meals facility. Operations at the school meals kitchen was also impacted by the presence of the coronavirus. This forced the operation of the school meal plant to be closed for 2 days. The Ministry of Education would like to express thanks to the American Bakery for providing lunch to 1,800 of our most vulnerable students on both days. Operation at the school meals has resumed with staff that have been tested negative and are fully vaccinated. The Ministry of Education continues its appeal to ask all parents, teachers, and students 12 years and above to be vaccinated in order to reduce the amount of disruption in students' learning. I must also indicate that the school meals facility has been completely sanitized since the outbreak. Mr. Speaker, this is the state of our school sector at this point in time in the midst of the COVID-19 pandemic. The Ministry of Education, with the support of the Ministry of Health and the entire government, continues to do all in its power to ensure that we provide a safe and healthy environment for both students and teachers and other staff to operate. At the end of the day, nothing can substitute the need for face-to-face instruction amongst our students, and we strive to maintain this as much as possible. I continue to advocate and to urge all of our teachers and school staff to become vaccinated, and to parents to ensure that their children who are 12 years and up use the opportunity to be vaccinated by the Pfizer-BioNTech vaccine. With this, Mr. Speaker, I will end. Thank you.